Hello, and welcome to Florida Hospital. If you are watching this, it is likely one of your family members has come to us exhibiting signs of a stroke, and you will want to know what that means for them here at our hospital. If your family member came in an ambulance, EMS called the hospital to prepare the stroke team to handle the stroke before you arrived. If you drove your loved one to the emergency department, our team has a protocol in place to quickly identify and expedite the treatment process. Our team will meet your family member by the entrance to the emergency department to quickly make an assessment upon arrival. Time is of the essence, so we will promptly evaluate their speech, ability to move their arms and legs, vision, and vital signs. Blood sugar and kidney function may be monitored as well. Tests in these areas can help the doctors to determine the potential severity of a possible stroke. A stroke neurologist will perform a neuro-evaluation promptly using technology that allows the neurologist to see the patient no matter where they are. After a quick assessment, a CT scan of the brain is performed. A CT scan can show the structure of the blood vessels that supply blood to the brain. The doctor will look to see if there are any blood vessel blockages, also called a clot, which would be classified as a ischemic stroke. If there is a ruptured blood vessel that has leaked blood into the brain, that would be classified as a hemorrhagic stroke. The patient may also have an EKG and chest X-ray performed to determine that they are well enough for treatment. If the doctor determines there is a blockage or clot on the CT scan, there are two treatment options. IV TPA, a time-sensitive clot-busting drug, which can help minimize the symptoms of a stroke, and surgical intervention, where a doctor will remove the clot by using a device that enters through an artery in the groin area and goes up to the artery supplying blood to the brain. Some patients may receive both treatments. The acute stroke neurologist will review and explain the risks and benefits of each treatment with you and your family member. After treatment, your loved one will be transported to a neurocritical care unit where we have a staff trained and dedicated to provide care for patients with stroke. Once they are there, you will be able to join them as they start their recovery. On behalf of the clinical teams here at Florida Hospital, we pray that your loved one has a great recovery. And if you have any questions, please be sure to ask for the nurse manager.
My name is Deanna Coopersmith Marquez, and I'm the president of the Scott Coopersmith Stroke Awareness Foundation, founded in honor of my late husband, Scott. I've been where you are, and it is my hope that this video booklet offers you some comfort and guidance as you navigate through this process and wait for your loved one. Stroke is a very scary condition, and it may be a long road ahead for you and your family. But rest assured, your loved one is in good hands, and you're not alone. Our foundation is here to offer you and your loved one support. Knowing what to do or who to turn to when your loved one is being released from the hospital can be an overwhelming and frightening experience. However, there are many resources available to both the survivor and the caretakers. Your next steps will depend on what services your loved one may need upon release. Very often, speech therapy, occupational therapy, and/or physical therapy will be necessary. Contact your insurance company to learn what is covered. If insurance does not adequately cover your loved one's expenses, our foundation may be able to assist. We are dedicated to connecting healthcare professionals with those affected by stroke through community outreach. Our foundation raises funds to further the awareness of stroke in individuals, encourage the rehabilitation of survivors, and provide emotional and financial assistance to survivors and caretakers. If you or your loved one is in need of assistance, please contact us. To learn more, please visit www.strokeawarenessfoundation.org. And remember to keep the faith and know that we are not only here, but we want to help. We would love to hear from you.